Good afternoon, everyone. Good afternoon, sir.
Good afternoon, Kirti. Good afternoon, everyone.
I welcome you all to live session from Dr. Makkar's Diabetes and Obesity Center. The topic of today's discussion is reversal of diabetes. It's a very frequently asked question by persons suffering with diabetes. And today's session of ours is an effort to bring you close to the reality about reversal or remission of diabetes. And it's an attempt to clear all your doubts regarding this term. Whether this term applies to all type of diabetes or there are some criteria to fit into it. So we have Dr. Makkar with us to give answers to all these queries. Before talking about reversal, let's know what is diabetes and how is type 2 diabetes different from type 1 diabetes.
This is the basic thing that I think everyone, not only diabetes patients, but even the people who don't have diabetes, should understand because diabetes is an important health condition which is affecting large population, and you should be aware what is diabetes. So, diabetes is a clinical condition which is characterized by increase in blood sugar level or blood glucose levels. But in lay terms, we say blood sugar is increased. And this increase in blood sugar results from two components. First thing is we have to keep in understand is that in a normal individual, the blood sugar stays in the normal range, and that normal range is less than 100 when the person is fasting and less than 140 after any meal. So blood sugar stays in normal range because of the various hormones that are there in the body and that keep the levels in the normal range. And the most important hormone that is involved in regulating this glucose level is insulin. So there is a very robust mechanism to make sure that the sugar levels are staying in that normal range by changing levels of insulin and its action, and there are other factors also. What happens in diabetes is that this regulatory mechanism is defective. So there are two components. One, the secretion of insulin is decreased, and second is the insulin, whatever is being produced in body, is also not very effective. So these are two ways insulin action can go low. One, if we are forming less insulin. Other, whatever we are forming is not effective in controlling glucose. So first thing is the insulin deficiency, and second thing is the resistance of various tissues to the action of insulin. So these are two key defects which lead to development of increase in the blood sugar level. Now in type 2 diabetes, insulin resistance is the predominant phenomena backed by insulin deficiency. Both the things are there, but insulin resistance is one of the major things, and the deficiency is only partial or relative, and it is progressive. In type 1 happens because of the destruction of insulin producing cells in the body. So there is absolute or near absolute deficiency of insulin. But the insulin efficacy is not lost. So type 1, there is deficiency of insulin, usually caused by a autoimmune process in the pancreas, which leads to destruction of insulin producing cells. And that is why all type 1 patients require insulin for controlling blood glucose level. Now, no other medication will work. Type 2 diabetes, we can improve insulin resistance, we can, improve the insulin sensitivity or decrease insulin resistance, we can improve glucose levels, we can improve insulin secretion because the cells which are producing insulin are not finished. There is significant reserve still there. Though there is significant loss, but there is enough reserve to produce insulin also. So either we can increase insulin secretion or decrease the insulin resistance, and we can treat it with medications. And once there is significant loss of beta cells, which are the insulin producing cells, and we can't have sufficient insulin coming from these cells despite all the oral medications, then we have to add insulin also. So this is the basic difference in type 2 and type 1.
So now let's come to the topic of the day, reversal of diabetes. We would like to know, can type 2 diabetes be reversed?
So answer is yes.
Can type 1 diabetes be reversed?
The answer is no.
So, but
As of now, we don't have any ways of reversing type 1. Type 2, yes, there are a lot of studies now that we can reverse type 2 diabetes.
So coming to my next question, sir, how do you reverse diabetes and whether it is a permanent one or it comes back?
So, first thing is we have to understand that reversal is actually not the correct term. Uh, when we say a reversal, we usually mean that you have reversed diabetes to normal state, absolute normal state. Or the other literal meaning of reversal can be, that you have moved from a stage, even few steps backward, you have reversed. Suppose somebody is not controlled and gets controlled. So you have reversed the glucose levels. So that is also reversal. But technically, these are all technicalities. So for all practical purposes, when we say reversal, we mean remission of diabetes. Remission is that a disease process has gone into remission. Now, when we are not saying that everything has come to normal level, and we are not saying this is permanent, we are not saying that person has got cured. It is remission, disease state has gone into remission. Now, how long will it, remain in remission is to be seen and varies from individual to individual, right? So, first thing is we should not confuse the term remission or reversal with cure. When we say we can reverse, that means we can induce remission of diabetes. Not in all the patients. There are certain things which are positive, which indicate that these are candidates where remission is likely to happen, and there are certain factors which will indicate that the chances of remission are less. But we can induce remission in people with type 2 diabetes. And the reason is the key hormone which is involved in regulation of glucose levels is still being produced by beta cells. There is beta cell reserve which is still producing insulin. Now, the focus is on decreasing the demand on those beta cells or the toxic effects on those beta cells which are caused by various metabolic processes that are involved in the causation of that, right? So that is how the reversal is possible in type 2 diabetes. In type 1 diabetes, we don't have beta cell reserve. It is already, destroyed. So, or it is very rapidly getting destroyed. So there is no way of producing insulin. So we cannot reverse this. Now, what happens is, some of the cases when there is acute damage to beta cells, there is very rapid increase in glucose level. And that increase in glucose level also suppresses the remaining beta cells to produce insulin. And in these patients, once there is rapid correction of glucose levels to normal, that toxic effect of high glucose levels on the remaining beta cells is taken off. And those beta cells start recovering, which were suppressed because of the very high glucose levels, start producing insulin. And for a while, the glucose level starts staying normal even without medication. But these people usually 99% have a very rapid decline of beta cell function, very rapid loss of beta cell function. That means rapidly declining insulin levels, and very soon they will come back to the diabetic state. So this is called honeymoon period typically for type 1 diabetes patients. Now this at times is projected as remission or reversal of diabetes by so called self claimed programs, but remission or reversal is not there in type 1. There can be a honeymoon phase which can be confused or maybe thought of as remission, but it doesn't happen in more than 5 or 7% of people. Usually 95% we don't have this.
So, sir, if we talk about remission of diabetes or reversal of diabetes, we will be talking about type 2 diabetes.
So largely, yes, largely, whenever we are talking of remission, we are talking of type 2 diabetes.
Perfect. Sir, so how do we reverse diabetes? How do we work on it?
So when we look at, see, how do we reverse it? First thing is we have to understand that how it is being caused. So as I mentioned, there are two key defects. One is the resistance to insulin action, and other is the decreased production of insulin. Both are going hand in hand. Now, once there is increase in glucose, glucose levels, this further causes toxic suppression of beta cells or insulin producing cells, which further lowers the insulin production from these cells. Now, one of the major defects that leads to development of insulin resistance as well as dysfunction or decreased function of the beta cells is the high levels of circulating fatty acids in the body. And if you look at the data, more than 70% of people with type 2 diabetes are either overweight or obese. In Indian setting, even those people who look normal weight and get diabetes, if you look at their body composition analysis, uh, then these people still, have higher amount of body fat as compared to the non-diabetic normal weight individual. So we Asian Indians, that is the ethnicity that we have, we tend to have higher body fat as compared to Western people for any given body weight. So just to look at the percentages, suppose there are two individuals with the same body weight, say 70 kg Western person, white person, and 70 kg person from Indian ethnicity. So the fat component of the body is almost 30 to 50% higher as compared to the same weight, same height person of a Western, ethnicity. And this high amount of fat actually predisposes Indian population to a higher risk of diabetes.
It can be reversed diabetes if a person is not overweight.
So what uh, first thing is when we look at the definitions of overweight and obesity, actually for Indians we have lower cutoff because of the same reason that we have higher amounts of fat. Now there are about 20% of people with diabetes who are normal body weight. But if type 2 diabetes, I'm speaking, when I'm saying diabetes, type 2 diabetes, and in these individuals also, there is a higher percentage of fat as compared to those people who do not have diabetes or who are not predisposed to diabetes. Second thing is we also have to keep in mind that there is a strong genetic predisposition which runs in families to predispose to diabetes. So ethnicity is important, genetic predisposition is important, and environmental factors are important. So in a genetically predisposed individuals, maybe a smaller increase in body fat will also lead to development of diabetes. While at the same time, a person who is not genetically predisposed, the larger amount of accumulation of fat may not predispose to diabetes. So that is why you will see heterogeneity in presentation. But most of the people, despite normal weight, who are developing type 2 diabetes, usually are having excess fat, and that too at the abnormal sites. This excess fat accumulation in so-called ectopic sites lead to insulin resistance and dysfunction of beta cells. So there is, though the fat excess, total body fat excess may not be very much, but there is excess fat accumulation inside the liver, in the pancreas, and in the muscle, which leads to the whole metabolic disturbance.
Basically, the story revolves around losing weight, sir.
So it is not just losing weight. It is important that we are able to mobilize the ectopic fat from these organs. You know, so there are medications which help in redistribution of fat also from these ectopic sites to the subcutaneous tissue or under the skin, and they also improve the diabetes status. So more important is where the fat is, not how much fat it is.
Okay, so you mean to say he- if a person with diabetes wants to go for a remission, he or she cannot do it by himself or herself. He has to be under guidance.
So person can attempt if the person can follow a very stringent, lifestyle intervention, have a regular exercise and a healthy diet, and also loses about 15% body weight over a period of say 4 months or 6 months. And those typically person has to follow the dietary modifications, moving to a appropriate proportion of protein intake, carb intake, and a regular exercise of at least 1 hour or so that there is improvement in the insulin sensitivity at muscle level, there is decongestion of fat from the major organs, and there is improvement in the insulin secretion. But most of the times when we induce weight loss, we have seen that most of the people are not able to lose weight significantly without the intervention, medical supervision, and support of pharmacotherapy. Only about 10% people are able to achieve significant weight loss. And that significant weight loss, when we say is more than 5%, is considered significant. But the amount of weight reduction required for remission of diabetes is actually around 15%. So if somebody is losing say more than 15% body weight, then chances of remission of diabetes are in the range of 80 to 85%. But if somebody is losing 10%, these chances of remission will move down from 85% to only 50% or so, right? So there is significant, decrease in the possibility of weight loss if the person is not achieving a weight reduction of to the tune of 15%. And that usually is not possible without pharmacotherapy or medical management of weight or something like bariatric surgery.
So let's consider a situation where a person is suffering from diabetes, maybe say for last 20 years. He or she is the ideal candidate for remission?
So this is again very important that if there is long duration of diabetes, the good chance that person's beta cell reserve is already lost, and it is very difficult or very unlikely that the reversal of beta cell function or insulin production will occur. So chances of remission at this point, I would say, will be very, very minimal or negligible. Most of these studies which have shown remission, whether it is the medical management of obesity or is it whether it is the data from bariatric surgery or weight loss surgery that is done, most of these studies have shown that chances of remission are good if you attempt remission within 5 to 6 years of onset or detection of diabetes. After that, as the duration goes on, the chances will keep on declining.
So there's a question from the audience. Can I take it first?
Yes. Fine.
If the weight is going slow down, say 10 kgs in 8 months' time, can one expect reversal in due course when good control is being achieved? But the duration of diabetes is not mentioned over here.
So first thing is we have to look at the overall profile of the person, right? How much is the duration of diabetes? How much is the overweight? How much is the, it is not just kilos which are important. It is the percentage weight loss that is important. and how the person is, attempting that weight loss, what kind of medications the person is on. So all these things will give a clue whether, person is going to get into remission or no. Cha- Unless, and if you look at the data from various studies, whether it is the medical management studies on remission or it is the bariatric surgery, what these studies have shown that we need to do a rapid reduction in weight loss. And what happens is when you are putting these people on rapid reduction of weight loss, that means, and the diets required for that are usually very low calorie diets or low calorie diets. And very low calorie diets should not be given without supervision, should not be taken by any patient or person with diabetes without medical supervision, because they can have their own, side effect profile or issues in, adapting properly. So what happens is when you put these patients on very low calorie diet, or whether you subject them to bariatric surgery, there is a very sudden decrease in the caloric intake, and that's acute restriction of calories coming to the body leads to reversal of fatty acid traffic from various organs, and that is what actually changes the functioning of uh, these organs towards normal. So we don't have data that if somebody is losing weight over say period of 1 year, and that too in the range of 8 to 10%, how much remission will happen. Most of the data on remission is from these studies with bariatric surgery, which lead to rapid reduction, or the remission studies again, which have caused rapid reduction of the weight. So slow reduction, I don't think we have much evidence that it can help in remission of diabetes. And second thing is, I must, convey here to all the listeners that please, if you are going for acute restriction of calories using something like very low calorie diets or very severe, fasting, please do not do it without medical supervision, because you can end up with complications. Just cutting down the meal is not sufficient. If it was that simple, we can tell everybody to reduce the food intake by 50%. But once you do that, you cut down your protein intake by 50%, you cut down your vitamin intake by 50%, you cut down your mineral intake, fiber intake, everything by 50%. What we need to cut down is only calories. And it is during that phase, it is very important that we maintain adequate nutrition in terms of vitamins, minerals, protein. And we should maintain a regular exercise. Otherwise, people will start losing muscle mass. And in fact, there are very recent studies which have shown that most of the people, even after bariatric surgery, the weight loss stops at certain point of time, but they have ongoing muscle mass if they're not exercising specifically. And that can be bad. So it is very important that one, you should have an exercise plan in place all the time, and you should be doing all these diet, strategies under medical supervision, supported by medication, if you are planning for remission of diabetes.
There should be a balance between your diet, exercise, and medication.
Yes.
So can diabetes be brought into remission phase in alternative medicine?
So, there are a lot of claims being made, and whatever the alternative medicines are, I am not the right person to comment on that, but usually they are using dietary supplements also only. And at some points, I have come across some diet formulations which use, stimulants, CNS stimulants. There is some of the diet supplements even use thyroxine hormone, you know. So all these can lead to side effects, and we have seen people coming with side effects from these supplements. They can lead to severe increase in heart rates. The things that are used as something called ephedra, which is a CN stimulant. There's something called chitosan, which is used. There is St. John's wort. These are the components which are usually put in these milk, and they are using caffeine and other things also. So I would never consider all these dietary supplements as or alternative medicine uh, as a way of remission. Second thing is most of the people would come and tell that, sir, I had gone for naturopathy, for 20 days, and I lost so much weight. My things, everything has come down. Now, if you ask them in detail, during that naturopathy program, they are giving them only boiled vegetables. They are not getting non-vegetarian food because most of these, places are focused on the herbal stuff or Ayurvedic, stuff. So meat is not a part of any of the plan. So there is hardly any protein intake which is happening. Short term, this is fine. Can you survive on boiled food for the rest of your life? The answer is no. Can you survive without a good protein intake? The answer is no. You have to have adequate protein. If you are losing weight without adequate protein supplementation and regular exercise, very good chance you will lose more muscle mass, which is going to be bad, and which will actually, in a way, hamper with your remission of diabetes also. So all these things, uh, when we are looking at remission, is just one component. Once you have put the patient in remission of diabetes, now what next? The most important thing is to sustain that remission over a long term. We don't know. Some people will have they will start getting their sugars back to the higher range in 3 years time, 5 years time also. But in our own setting, we have patients who are still in remission more than 10 years. Important thing is, are you able to sustain them at that body weight and in that lifestyle? So if something has to be done over a long period of time, we have to make sure that person lives more or less normal lifestyle with adequate exercise and a normal food, though the person has to be, trained on avoiding overeating and avoiding high calorie foods. But you can't be, telling them to be on supplements for rest of their life or on boiled food for rest of their life. Something to be sustainable has to be as close to normal as possible. And then only you will get good results.
So, sir, as per you, there is no particular food which helps to reverse diabetes. Which
No,
claims are being made?
no. I would, not take any claims. If they were so good, they would have reversed everybody's diabetes by now.
Sir, I would like you to comment on my following statement that there are claims that you take good amount of fruits, good amount of salads, which are known to increase insulin secretion. I know what I'm talking is little weird, but I have heard of these claims. Is it okay?
So there
Instead of a
is,
normal meal.
there are some very sketchy or preliminary studies with some of the things like Karela or methi seeds. These are the commonly uh, perceived things that are supposed to help diabetes. And every single park or district park where you go in the morning, somebody is selling that mixed vegetable juice or Karela juice, and so all these juices are good for those who are selling it, or if mm, I don't know what to say about it. I have not come across people who have good control of sugar levels and they are drinking Karela juice or vegetable juice. Those people who are not controlled, those are the people who come to us and they give, I am taking Karela juice also, it is not getting controlled. I am taking methi seeds also, it is not getting controlled. So that only shows that these are all desperate attempts which are tried by people, but they don't work. I have not seen anybody who is in the range of 250 and is, starts taking Karela juice every morning and the sugar comes down. There may be minor changes that can happen with any good vegetable or fruit intake, as long as you are not consuming very high calories, you are consuming adequate fiber, adequate minerals, it is going to help. But some of these sketchy studies have shown that some of the, what they call is the there are components in these vegetables and fruits which have something like, pro-insulin or insulin stimulating effect.
Dalchini
But
and methi dana, sir.
so with methi dana, we have recently had a, very long study under the aegis of Research Society for Study of Diabetes in India, done in 5 major centers across India for more than 3 years now. And the impact of taking methi dana is similar to a high fiber meal. There is no difference. And then for that, you have to take 2 large spoons of methi seeds, at least, I think twice daily. So it is just fiber. It is nothing beyond that.
So my next very important question to you is, what will happen if my diabetes is brought into remission phase?
What will happen means what?
To my body?
So see,
Why do I want to go for remission?
so remission means that your metabolic function has come towards normal side. So basically, once you have diabetes, it is why it is happening. You have a deranged metabolic process in the body. Once you have normalized it or brought it closer to normal, then only your remission will happen. So having a normal metabolic process in body is an indication now you have moved towards a healthy state. Second thing is, if your glucose levels are normal, your metabolic processes are normal, the ongoing damage that is happening in body because of the abnormal metabolism, which may be subclinical, which may not be visible to you, but there is ongoing damage happening, which leads to long-term complications of diabetes over a period of 5, 10, 20, 30 years. So if you look at people with diabetes, the chances of having a heart attack are 4 times higher. The chances of getting all kinds of, vascular diseases like stroke, like uh, foot problems, like blocking of the arteries, or damage to eyes, kidneys, the risk is increased significantly. And if you control the diabetes well, the risk comes down significantly. So you have normal functioning of the major organs of the body, or near normal functioning, and the damage is slowed down or nullified by a very good control. So if somebody gets diabetes, say in the range, in now we are seeing diabetes in the age group of 40s, and average life expectancy is somewhere going to be around 76 to 80 years. Somebody who gets diabetes has to live for another 35, 40 years. Now, if person is uncontrolled, chances of getting complications by 50 years of age are very high. When the person is in prime of life, very much, working class, useful to society, important for family, has to take a lot of responsibilities for family, gets stuck with the complication. If you have reverse diabetes, you have changed the trajectory, and the person is either likely to get these complications after 30 or 40 years, by the time person has more or less finished his lifespan and lived a good quality of life. It is not just the social implications or family implications. The minute person gets complications, his quality of life is also, compromised. So he is suffering, his finances suffering, his family is suffering, he's less productive for the society, he becomes a healthcare burden, everything is changing. So by reversing diabetes, you can change the whole story. Even if you are not able to reverse, I didn't say that 100% you will reverse. Good 85% chance you will get into remission if you are, candidate for remission, and you have come to the treating physician within 5 to 6 years of onset of diabetes. Now, even if those 15% who do not reverse, they will achieve very good glycemic control, good glucose control. They will improve their metabolism. They will improve their muscle mass. They will have better performance in terms of, good quality of life, reduced risk of complications. They will, even if they get complications, they will get after 30, 35 years. So still they are doing very, very much better than those who are not, attempting reversal or having a good glucose control.
So basically, it's a win-win situation.
Yes, absolutely. I think anybody who has diabetes within 5 years of onset uh, and is willing for good lifestyle interventions should be considered for remission of diabetes in today's world.
Actually, sir, a lot of hype is also being created about this reversal of diabetes on social media and all platforms.
Yes,
In
so that I have seen lots of videos and I have seen lots of claims being made, but I think good many things are not true. A lot of things that are being claimed don't happen, and we should focus on what we have in terms of science available. And what I have told you is absolutely based on the scientific studies that we have seen.
So the best thing about this hype is that at least awareness is being created in the
Yes,
society.
people are becoming aware. People
Yes.
are becoming aware, but also they, end up at the wrong places with the false promises, and then they come out with bad experiences.
So, sir, that brings to the end of this session for the day. Any other point you would like to comment on?
Uh, I think we have discussed most of it. The most important thing is, I think people should be aware that type 2 diabetes, which happens during the adult, age mostly, is a stage, it's a disease state which can be controlled well, or in the initial phase of disease course, can even be reversed or get into remission. And person can live a good quality of life with, minor modifications in the lifestyle towards a healthy lifestyle, I would say, and can stay off or without complications for most of the lifespan if they control their diabetes well or they attempt the remission of diabetes. And it is very much possible. It is very much possible. There is very significant chance that if you are within 5 to 6 years of diabetes onset, good 80-85% chance that you can get into remission if you do it properly.
So thank you everyone for joining.
Thank you. Thank you everyone for joining, and hope to see you next week also at the same time.